be confusing to people is when should they call their doctor, what is an attack, how can they have symptoms when the MRI doesn't look different. What I tell my patients is that as we're meeting over time, we're trying to get a sense of whether their disease is stable or is active. And we do that in several ways. One is we ask the patient their symptoms, whether they feel better or worse. We perform a neurologic examination to see if there are new or worsening findings on the examination. And periodically we do an MRI scan looking for either new spots, new lesions, or activity. And we detect that by the gadolinium injection that you may have had during some of your MRIs. None of those is the end-all. None of them trump the other ones. They're all ways of triangulating on how the disease is doing. We know that none of them completely captures what's going on. One point of confusion is distinguishing a relapse, an attack, or an exacerbation. Those are all words for the same thing, from just symptoms that may fluctuate. So typically an attack is a very clear-cut event where either brand new symptoms develop over several days, or sometimes old symptoms may clearly worsen. They persist for typically a week or two, and then start to recover on their own often, either back to normal or with some residual. In retrospect, a relapse is typically very clear-cut. Now, what can be difficult to distinguish is the early stages of a relapse, where symptoms are just starting to develop, from the fluctuations in symptoms, pre-existing symptoms that many people with MS experience. So sometimes people had a previous episode that led to weakness. They may find that on some days their weakness is a little bit worse. Sometimes that can just be from being tired. It can sometimes be the indications of that an infection is brewing, often a urinary tract infection. It can be the weather, or sometimes it just happens for reasons which we don't understand. What we tell our patients is that if they are concerned that something is changing, that would be a good time to contact your doctor's office and let them help sort out whether it is something of concern. On the other hand, if you don't need to worry about symptoms that may come and go a little bit one day and then they're gone, that's probably just these fluctuations.